11:05, and we are here, a special 2-hour edition of the Dr. Payne Show. How about that? I got you out of bed. Actually, no, that's not true.
No, I went to bed at 5 o'clock this morning.
What's wrong with you? You're a doctor.
Yeah, we were out for a friend's party, so yeah, it was a late night.
Okay. You all right?
Yeah, I'll be fine,
You
I
look
think.
fine.
It'll hit me around 3, 4 o'clock.
Your breath is okay, so I don't think you were beveraging.
No, it wasn't a matter of getting drunk. I'm fine. I'm sober.
416-870-6400, star 640 on cell, and Dr. Lou is here. The number 1-855-55-DRL. OU is his number to get a hold of the practice and check it out. But we're taking your calls all morning for the next 2 hours anyway. You have issues, be it physical or otherwise. You have no answers, want to get some answers. Dr. Lou's here to answer those questions. How was the week, pal?
Very good, actually. And I have a couple interesting cases that I'd like to discuss with everyone that kind of touch on that topic that you were talking about. If you're out there, you're listening, and you just want to get a second opinion. A lot of people that I've seen this week, It was just a matter of getting a second opinion to make sure that A, either what they were told was right, or B, what they told was wrong, and they should try another option. So a couple interesting ones that I wanted to talk about. Some were actually very simple. Some were a little more complicated. One was a lady in her middle-aged lady, very, very active, lots of yoga stuff that she was doing and is currently doing. And she was complaining of a hip pain right in the groin. And I don't think we've talked about hips all that much on the show. I think we've almost talked about every other body part, but for some reason, and that's why I was like, oh yeah, I should probably talk about hips and how important they are. And so she came in, and her complaint was essentially that when she's doing a lot of her yoga poses, she feels this really sharp stabbing pain right in her groin. Sometimes people mistake the hip, and they'll kind of point to the back right around their butt, but the actual proper hip joint is actually in the front right, next to the genitalia.
Yep.
And so she was complaining of pain in that area. Now, what I did there was I went through my physical exam. First, we did a full history just to get an understanding of when this bothers her, because like I've said many times, you have to do your detective work to figure out the type of pain that they're having, when it's happening, what's relieving, what's aggravating. That way you can kind of start to form what's called a differential diagnosis, things this could be. Right after the history, I knew for sure that this seemed very much musculoskeletal. It was related to the muscles, the joints. It wasn't anything more than that. The next thing I had to determine, and I was pretty confident at that point, that it was what's called an FAI. FAI is femoral acetabular impingement, which just means there's impingement in that joint. That could be due to two things. You can either have severe arthritis, so when the bones actually start to change. If you actually look at the hip, the thing that's so special about the hip, and it's very similar to the shoulder, it's a ball and socket joint, which means it has a ton of different variations of movement. So you can flex it, you can abduct it, you can adduct it, you can extend it, versus say something like the knee or the elbow, where it's just simply flexion and extension, and it's a hinge joint. It actually looks like the hinge on your doors. So the hip has a ton of different movement. And what happens is if due to any type of arthritic changes, if that ball shape of the femoral head starts to change, or the acetabulum, which is kind of a cave that fits into there nicely, if those things start to change from a bony standpoint, like with arthritis, the bone will hit as you're moving through the ranges of motion, and that's the impingement. That's what you're getting. And now, obviously, in that scenario, if it is bony changes, when hips degenerate too much, you do get to a point where you need to have hip replacement. Yeah. And it actually is the gold standard. It tends to work very well when someone, and I mean, this again, you have to gauge it, you have to understand clinical indications, you have to look at the imaging. But then what I did with this lady was, and it's kind of hard to explain here over the radio, it's a little bit easier to explain it visually. And for all of those people listening out there that want the visual component of the things that I talk about.
We'll do TV next week.
Well, TV is coming, but before TV, add us on Facebook. Add me on Facebook. We put a ton of this stuff. It's Dr. Lou on Facebook. Just type it in, and I'm there, dr.lou. And you can follow me, and I put up these videos so I can show people. So I'm going through the range of motion, and then what I did was I distracted her hip as I was going through that range of motion. And what I was essentially able to find was that the impingement she was having was not actually due to a change in the bones. What it was due to a tight capsule, which is the ligaments and cartilage and the other tissues that surround the actual joint that keep it in place.
Yep.
So, and she's from Oakville. So, and she was seeing a massage therapist out there that she really liked a lot. And, all I basically said was, if you're happy with the person that you're seeing, and I think this is something that a massage therapist can deal with, I just gave the massage therapist a letter on some special things to do specifically to strip out the capsule.
Right.
And, I showed her what it would feel like. And right away, she started to feel better. And it was a very simple case, but she's been living with this for so long. She was unsure. But again, this comes down to, if you're a good detective, a good diagnostician, you could determine what's going on. And what do I always say? If you've got the right diagnosis, you're going to get the right treatment. And up until that point, the diagnosis wasn't really there. And so, that was the issue. The diagnosis was wrong. It was being treated the wrong way. She has to have someone get right into the capsule, release that capsule, and she'll start to feel better.
Joe, we'll get you a quick call here before we break. Hey, Joe, good morning, or good afternoon almost. How are you?
Hi, I have my mom was diagnosed with Paget, and she's on a protocol now with the doctor. Is there anything like nutritionally or vitamin-wise that can help support that or anything like that? I'm just going to hang up and listen to the call.
Sure.
Thanks, Joe.
Yeah, so Paget's disease is very rare, actually. What it is essentially the bones start to enlarge and then also soften. So it's kind of a double whammy that happens. Anytime you're looking at bone-related things, obviously having a good amount of calcium and vitamin D, which work together, and that's very important, that understanding that you have to have calcium with vitamin D just because of the way it's uptaken, is usually a good idea. Paget's is a little bit different than just, say, something like an osteoporosis. Right. So it is a little bit different. And again, because it's so rare and the pathology is totally different, there's not, tons of things, more natural things that could be taken. And usually this is something that has to be controlled with some type of medication, good physical therapy, and those things. So there are some things I'd have to understand a little bit more about what she's doing as well in order to make specific recommendations on specific natural products. The thing about natural products is you can't just throw them all at a person, because you have to understand what they're doing. And sometimes I'm hesitant, because if they're on a certain medication that has a counteract with another type of natural remedy, I'd want to understand that a little bit more. But, I guess we're going to break, and I'll discuss it a little bit more when we get back.
Your calls, 416-870-6400, star 640 on cell, a 2-hour edition of the Dr. Payne Show right till 1 o'clock. Your calls, bring them on. We're ready for you. Got some open lines and lots of more of that when we return here on the Dr. Payne Show Talk Radio, AM 640. 11:14, the special 2-hour edition of the Dr. Payne Show, 1-855-55-DRLOU. Dr. Lou, when the show is over, you can get a hold of Dr. Lou right there. info@paincarecanada.com is for emails, and the clinic is ready to take you if you need some help. It's over the phone calls. Bring them on, 416-870-6400, star 640 on cell. You got some time till 1 o'clock to get your questions answered. So, what was that condition we were talking about before the break?
So Paget's disease, essentially what happens is it's caused by excessive breakdown of bone, and then it starts to, the bone doesn't organize properly the way it should. And what ends up happening is these bones get bigger, but they get weaker. So it's overall a softening of the important parts of the bone.
Are they not as dense, or?
Yeah, it's just a pathological breakdown of everything. In fact, these people, you tend to find they have high, on their blood work, high alkaline phosphate levels because the bone's being broken down. And so the big concern with it is, number one, people usually don't know that they have this until they start feeling pain. And so a lot of the times it's just an incidental finding because someone's having pain and they think it's just, some type of regular musculoskeletal pain. It persists. It's not getting better with the treatment that they're doing. All of a sudden, someone decides, let's take an x-ray. And then you take the x-ray and you end up seeing it. And then once you've seen it, the thing is it's not... The reason why it's dangerous is because as it softens, you can have fractures,
sure,
right? And that's the dangerous part. And depending on where it is, that, you have that risk of those fractures happening, and then you have to, keep that in check. But anytime, again, you're dealing with bones from a natural perspective, and, it kind of goes for everybody that, especially women. Women tend to... are more prone to bone issues like osteoporosis. The thing that people need to understand is at some point, as you get older, your bones are going to start to slowly
sure.
break down. So the goal really is that you want to build it up to a higher peak so that that decline takes longer. That decline starts to happen around 30 years old.
That's shocking.
Yeah.
Nice.
Well, yeah, so 30 years old. So the important things that tend to keep bones healthy, again, are calcium with vitamin D. Vitamin D is, the sun, right? Which is a problem why we have a lot of things here in Canada and, in northern climates, because you start to minimize the amount of vitamin D. The other thing about vitamin D that would be interesting for people to know when they're in the sun, it's not enough to be behind a glass or something. It actually has to
have
hit
contact.
Have contact. The other thing is a lot of vitamin D actually gets absorbed around the eyes. And a lot of times we wear big sunglasses when you're out in the sun, right? So it's kind of a double whammy. So sometimes take those sunglasses off, get a little bit of sun on your face. But yeah, anytime you have something going on in the bones, you want to try to, prior to 30, weight-bearing exercises.
I was going to say lifting weights is great for the bones.
And the funny part is women tend to have more bone issues and men tend to have more cardiovascular issues. But then when you're at the gym, you're seeing the guys lifting the weights and the women doing the cardiovascular workouts. So it's actually should maybe be the other way around, where men are focused on the cardiovascular since they're a little more predisposed to that, and women focused on the weight-bearing exercises in order to build up those bones. Then good nutrition is another part of it, of course, and get it up as high as you can by the time you're 30, and then it starts to break down. But again, for the gentleman that called with regards to Paget's disease and specific things, besides me going any further with saying sunlight and vitamin D and calcium, have that person give me a call. Let me understand exactly what she's taking, what she's not taking, and then from there I may be able to make better recommendations.
416-870-6400, star 640 on cell. Daniela, good morning.
Good morning. How are you?
Excellent. How are you? What's your concern?
My dad is 79 years old, and he's been struggling with his walking. At first, they were mentioning Parkinson's, and now that's been ruled out. But the word gait apraxia, they said that that's what his condition might be. Could you give me some suggestions on what he could be doing to improve his conditions and maybe help him with his walking?
Sure. So gait ataxia is kind of the more important thing to figure out at that point. It's kind of that's a symptom. That's like someone saying, "Oh, he's got a fever," and it's like, okay, but why does he have a fever? Gait ataxia could be related to what happens is your cerebellum, which is so you have your brain, you have your brain stem, and then your spinal cord, and then below your brain there's something called the cerebellum. That cerebellum controls coordination of movement. And so what can happen sometimes with a gait ataxia, if there's some type of lesion in the cerebellum, it could start to affect that. It could also be related to vestibular things, where we've talked about this, the relation between the eyes, the inner ear, the neck, and there may be things going on that way that are causing the ataxia. So yeah, it sounds like they're probably on the right track. They're trying to rule out the more pathological and neurodegenerative things like the Parkinson's disease. I'm going to assume he's had an MRI of his brain?
They've had CT scans. He has a pacemaker, so he's not able to have an MRI.
Okay, yeah, so CT scans, same. Well, not same, but it'll give you the information that you need. They probably likely would have picked up in the cerebellum something if there was there, and maybe not. But yeah, the important thing is trying to, if it is gait ataxia, is trying to figure out, again, that's just a symptom. What is leading to that ataxia? Is it a problem with the cerebellum that's not causing coordination issues? Is it a problem with his vestibular apparatus? And the vestibular apparatus is the relation between the eyes, the inner ear, and the neck to understand where your body is in real time and space. So it could be a multitude of things. You'd have to continue going down the path of getting tested to try to figure it out. Again, this is something that, if you like, we can have a more appropriate free consultation, and I can kind of divulge into a little bit more information and see if there's anything there that maybe sticks out to me and suggests that maybe more one thing versus another.
Okay, that's good. And is physiotherapy and osteopath something that would be beneficial to him?
Again, it depends, right? So that's the component of what I was talking about when we when we first got on of the right diagnosis makes for the right treatment. It really depends. Let's say it is a cerebellar lesion, just to, for assuming here, then, what is it that the osteopath or the physio are going to do is the next question, because those are just the names of profession that can do multiple interventions. It's about finding the right person that deals with it the right way. So give us a call. We have all those people, and we'll try to get you, in the right place if that is something that you need.
Danielle, it's 1-855-55-Dr. Lou. That's DRLOU, 1-855-55-Dr. Lou. And to call in this morning, we'd love to hear from you. We're here till 1 o'clock, the 2-hour edition of the show. 416-870-6400, star 640 on cell. The Dr. Payne Show, Talk Radio, AM 640. 11:25, Dr. Payne Show. Lots of phone calls to be had. We got open lines, 416-870-6400, star 640 on cell. And Jonathan, good morning, pal. How are you?
Good, and yourself?
Good. What's your concern?
I have a question. On my right side near my shoulder blade, my rhomboid, I don't know what it is about it, but there's always like a triggering pain there, and I massage into it, and it releases it, and I feel better. But then I wake up the next morning, and that tightness is there. I don't know if it's my posture. I don't know what it is.
Okay,
but it bothers me.
What do you do? Like, tell me a little bit about like what your lifestyle's like in terms of work. Is it physical labor that you're doing?
No, it's pathetic. I'm a teacher.
That's not pathetic.
Being a teacher is pathetic, or the... My brother's actually a vice principal. I have lots of teachers in the family.
Oh, yeah. So I just lift chalk to a blackboard. That's all I do with my right arm.
That might be enough.
Hey, yes, exactly. That might be enough. What about physically active, like you working out a lot, sports, etc.?
I play soccer and I go to the gym 3 times a week. I was in a car accident maybe 6 months ago, but it was something that bothered me before. In my early 20s, I used to serve and carry trays, and I think that's where it maybe stems from. Okay,
and have you ever had it treated by anybody?
No, just at a physiotherapist after the car accident. I complained about it, and we did some shoulder exercises.
Sure.
Shoulders,
Yeah, so one of the things with rhomboid issues where people can sometimes think, okay, it's a problem with the muscle itself. It's very important underneath the rhomboid are the ribs. And sometimes ribs can, I don't want to say come out a little bit, but sometimes they do. It's an articulation. It's a very small joint. And sometimes that joint might be a little bit off. And so sometimes actually putting that rib back in place tends to help, and that may be the issue. Now, what happens when ribs come out in an area? It's usually due to there's a weakness in the rhomboid or something like that, which is responsible for holding everything down. And so you may have a better, and again, I'd have to see it, but just kind of hearing what you're saying, you may have a better outcome if you got someone to kind of put that rib back in place, and then versus pushing on the muscle, do things to strengthen it, to keep it. It might take a few treatments, some rehab to get it better, but it might not just be as simple as a rhomboid issue. It might also be what's under the rhomboid, which is a rib issue.
Okay, cool. Thank you.
Okay, no problem.
The number 1-855-Dr. Lou. By the way, Jonathan, you want to give him a call, free consultation, pop by and get to the bottom of it. Kathy, good morning.
Hi, both of you. Dr. Lou.
Yes.
My dad is 88, 2 hip operations.
Okay.
Last weekend, he woke up with a very, very severe pain in his right hip. The pain occurs anytime he puts any weight on it. It hurts when he sits down as well. The pain is so severe that it almost leaves him breathless. He's had multiple x-rays. Okay. They haven't found a problem with the joint. They've told him it's due to his age or the weather. He can't live like this.
Yeah. Is he doing any type of therapy towards the muscles surrounding the joint, like any type of regular massage, treatment with active release, anything like that?
No, not at this time.
Yeah.
The therapist did see him this week and suggested it's some type of inflammation problem.
Yeah, sometimes what tends to happen with joints is a lot of the times the pain-generating source is actually the muscles surrounding that joint where it all tightens up and things aren't working the right way. So it could just be as simple as something as a muscular issue and not necessarily related to the joint itself. It could also be a synovitis, which would be an inflammation actually in the synovium, which is within the joint of the hip, which is the characteristic findings for synovitis are what you're saying is extreme pain. Every range of motion hurts. But the one thing that would tell you it's a synovitis is if he took some type of an anti-inflammatory and he felt better, well, that would control the inflammation. So you could kind of experiment with a diagnostic process that way, where if he took some type of over-the-counter anti-inflammatory, as long as he doesn't have any contraindications to that. Again, I don't know because your dad's not my patient, but that may figure out if it's something in that. I see you're calling from Brampton, which is not far from my main clinic. We could also set something up where I could take a look at it and try to see exactly what it is that's going on. And again, these things are always better when I can do my proper assessment, figure it out and then make the right recommendations. And so far, I had a lot of people this week that were saying that, you must be helping tons of people. And they were just so happy to have come see me. So, I'd love to play a role in your dad's healthcare. So if you're okay with it, maybe give us a call and let's set something up.
Yeah, I'm sorry. I haven't been listening to your phone.
No, it's okay.
Driving. Can you tell me your Brampton Clinic phone number?
Yeah, I think John knows the number. 1-855-55 Dr. Lou. That's DRLOU.
1-855 Dr. Lou, right?
Yeah, just paincarecanada.com is the website, and all the information will be there.
Yeah, 1-855-55 Dr. Lou is that number. And for the rest of you who want to call through, talk to us this morning. We'd love to have you on till 1 o'clock, the 2-hour edition of the Dr. Payne Show, 416-870-6400, star 640 on your cell. And 11:32, 2-hour edition of the show this week. Loving it, 416-870-6400, star 640 on cell. Dr. Lou is here. And by the way, info at paincarecanada.com is the email. And to book a free consultation at the clinic, 1-855-55 Dr. Lou. Got Nick. Nick, good morning. Thanks for hanging in, pal. How are you?
Good morning. So Dr. Lou, I was having some shoulder pains earlier in the week. I went to my doctor and got some imaging done. And it came back that there's a partial tear.
Okay.
And some nerve impingement. And he's recommending physio.
Yep.
I just want to get an idea from differing philosophies on medical care. So I was wondering, other than physio, what else could be recommended for partial tears and nerve impingement?
Yeah, the best thing would be something down the rehab route for sure, just because it is a muscular issue. One of the things that I've talked about a lot with the shoulder is, and we had an orthopedic surgeon on a few months ago. He's a colleague of mine that I work with very closely, who actually operates on shoulders. And one of the things that's very interesting about tears is that oftentimes the source of the pain is not actually the tear. The tear is very analogous to gray hair of the muscle. So tears just tend to happen over your life. And if we took ultrasounds and imaging studies of 100 people, a lot of people would have tears and no pain, and some people would have pain but no tears. So it doesn't often correlate very well, and it may not necessarily be the pain-generating cause. It just seems sometimes as an incidental finding that you see on an ultrasound, and because it's the word tear, you tend to believe, that's got to be the pain. Yeah. Same as degenerative changes like arthritis, osteoarthritis in the back or the hip, not always the cause of the pain. One of the very important things about the shoulder is posture. Your shoulder essentially attaches to your body through the scapula, which is the shoulder blade, which articulates with the rib cage, and that's pretty much it. And then a bunch of muscles holding it in place. And that's really the only way that shoulder is getting stuck to your body. And a lot of the times with shoulder issues, especially, again, this is the visual component, and why, if you're listening and you have Facebook, add me, because we can go through these things on there. Mm-hmm. Also, a TV show coming out later in the year to really highlight these types of things from the visual perspective. But if you can change the dynamic of the whole shoulder girdle and the way it sits on your body, well, you can take a lot of stress off of different muscles and tendons and impingement and things like that. And oftentimes that is why impingements are happening. It's just due to poor posture. The shoulder blade tends to fall forward because our world is in front of us, and it falling forward just ends up putting pressure on structure. So, this is, again, and everybody's shoulder blade is different because everybody's body is different. So in terms of what proper exercises you have to do to keep it in what proper place, all goes based on doing a proper assessment. So does that kind of answer your question, Nick?
It does, yeah. I just want to get an idea sometimes. I didn't want to get caught up in philosophies of medicine and approach. So, yeah.
No, and you know what? Anytime, and I've said this before, if you're going in with a physical issue, something that's musculoskeletal, and they're recommending an intervention that's physical in nature, like a physio, massage, chiro, et cetera, you're probably going down the right route. root. What's more bothersome to me is when you go in with that and here's a pain med. And that may not necessarily work, right? You should try to do physical intervention to a physical problem.
Awesome. Thank you.
Okay, no problem.
Thanks, Nick. Got Daniel on line. Hi, Daniel. Good morning.
Good morning. How are you?
Good. What's going on with you?
I'm developing pains primarily through the evenings, muscle pains, but it's at different locations at all times. I mentioned it to my doctor. He seems very dismissive of it. I know it's in excellent condition, and I'm drinking the water, eating the bananas, yet I cramp for no reasons.
Where are the cramps happening? You're saying all over the body?
Well, it can happen in the calves and the thighs, and even in the abdominal region, sometimes in the arms. I don't know if it's just part of muscle atrophy with my aging.
How old are you?
58.
Well, you're not that old, right? Where you would think that's something like that. You did mention you're taking, you're trying the bananas, which is good from the potassium standpoint. One of the things that can also lead to cramping is magnesium issues. And so, sometimes, and again, good sources of magnesium, any green vegetable. So lots of salads, broccoli, things like that. The other thing that sometimes this is where I'm not a huge fan of supplement. It's funny. You meet a lot of people. They do everything wrong in terms of exercise, diet, but they're on every supplement in the world. It's like, no, it's got to be the other way around.
Back it up
but if you are doing all the right nutritional things and you're still having issues, you may have a deficiency in some type of a mineral, and you may actually need to supplement a little bit more. So, even though you're having the bananas, it may not necessarily be enough potassium, or maybe your magnesium levels are not high enough, and that could be leading to it. Another thing that's very important for muscle contraction, and we don't often think of this because we think calcium, we always think calcium is related to bones. It's actually not more, but as equally important in the contraction of muscles. So those three things are some big types of minerals that can play a role in muscle cramping. So I'm not sure what your overall diet is like.
Other than the Lipitor, which my doctor felt it might be a result of, yet I continue to take, I just wondered if it was an onset of a possible other disease. Maybe I'm a little bit overly concerned.
Sure. And again, this is why an assessment is so important, because you get talking to someone, and now that he said that totally changes everything. Lipitor and cholesterol types of drugs, statin drugs, eliminate something from the body called CoQ10. CoQ10, again, is very important in pain and muscle contraction. And sometimes really what should be happening is anyone prescribed some type of cholesterol medication should also be taking CoQ10. So I would definitely have that conversation with your doctor. And if you're not supplementing with CoQ10, have that conversation, and maybe that's an answer. And we have seen a lot of people in practice that come in with pain or on some type of a statin drug. You recommend CoQ10, it starts to get better.
No kidding.
Yep.
Cool. Very much.
Okay.
Glad we could help you, Daniel. We'll get to, Dennis just before we break. Hi, Dennis. How are you?
I'm good. How are you?
Good. What's going on with you?
Good. Lower back issues. I had a.
Those are not common.
Yeah, right.
Low back. Go ahead.
I had a lifting injury probably about 15, 20 years ago, and I was off of work for about a month.
Yeah.
And I went for a physio and whatnot. I got better, and probably about 10 years ago, it started to come back, I guess. I've been seeing a chiropractor, actually quite a few. I've been to physio, but it doesn't seem to be getting better.
Okay, so one of the things for sure that I want everybody to know is anytime you have an injury on any part of the body, you're more likely than someone who doesn't have that injury for it to come back again, right? That's just the reality. Even like cancer patients. You can go into remission, but you still always have to keep getting checked. You're at a higher risk of it coming back. That's just unfortunately the way the body works. So it's not uncommon that your low back pain came back, Dennis. That's definitely not surprising. The next thing with treatment and the way usually low back issues work is the way treatment should be graded is it should be very much passive interventions in the beginning to help get the pain down, get you functional, et cetera, et cetera. And by passive, I mean the things that the person, the physio, the chiro is doing to you. And then in order to keep it at bay from coming back, the more important component becomes the self-rehabilitation that you're going to do, the active care, and doing all the right things, building up a good, strong core with, there's specific protocols on this. So I'm not sure if you've ever been shown those things. And then the other thing I'm not sure of is how compliant you are with those, because that's very important from a diagnostic and treatment and plan and management perspective is you have to make sure that the person's recommending the right things, the practitioner recommends the right things, but you equally have to make sure that the patient is compliant.
For sure.
And rehabilitation is not easy to do it properly. It does take a lot of hard work. So I would say if this is a long-standing issue, anytime you have a chronic low back pain, really the research supports that the treatment intervention has to be proper rehabilitation, graded rehabilitation, which is just as important. You don't want to, sometimes people just go into the hardest things possible, but you have to build it up. You have to crawl before you can walk, before you can run. And sometimes the beginning phase of rehab has to be very simple and needs to get harder and harder as you start to become better in the lower stages.
416-870-6400 stars 640 on sale. The 2-hour edition of the Dr. Payne Show continues. We got some open lines. Give us a call. We'd love to hear from you right here. Talk Radio, AM 640. 11:43. Yeah, we got another hour after this. This is a 2-hour edition of the Dr. Payne Show. Call that number. We got open lines to talk to you. And outside of show hours, 1-855-55-Dr. Lou to book a free consultation. Want to throw an email Luigi's way. It's info@paincarecanada.com. Got Isaac on the line. Hey, Isaac, how are you?
Good morning, fellas. How you doing?
Good. What's going on with you?
Long story short, I've been on the operating table 3 times in my life, and I just turned 27 last week.
Wow.
I have steel rods in each leg. I've broken both my legs in the tibia. I've also got a reconstructed wrist that bends at a 45-degree angle each way. And so, yeah, I've got a lot of metal in me. I'm pretty much Iron Man.
Okay.
Long story short, should I be taking arthritis medication even though I don't have it, just to prevent the onset of it coming on, even though it's inevitable?
Okay, so let me ask you one other thing first. Why it was the broken bones and the fractures due to things that you did, or do you have some type of pathology going on that leads to soft bones and increased risk?
I was definitely self-inflicted.
I'm sorry?
Definitely self-inflicted.
Self-inflicted, okay. Okay, here's the bigger thing, arthritis. So people often use the term arthritis, not realizing that there's one type of arthritis, which is osteoarthritis, right, which is wear and tear. And then you have other types of arthritis, which are due to autoimmune diseases like rheumatoid arthritis, ankylosing spondylitis, et cetera, et cetera. There are special class of medications for that side, the autoimmune diseases, which tend to keep the immune system at bay so that it doesn't attack you and attack your joints when you actually have that. Then on the other side with osteoarthritis, really the medication is just pain medication. So my simple answer to you be no, don't just take, pain medication to try to prevent pain, because all you're going to do is adapt to that medication. And then when you actually need it, it's probably not going to work. And even over the long term, it may not necessarily work anyways. If you're concerned about potentially developing arthritis, which you're right, it is inevitable based on your history that the more more injuries that you have, the more likely those areas are going to degenerate. If you're concerned about that stuff, that's where getting good functional assessments is probably more important so that you can understand range of motion. The other thing is maybe having a practitioner who does some follow-up studies to look at things. One of the things I always recommend to people, let's say someone comes in, they have a hip issue, I determine it's probably related to, some slow start of arthritis. I usually like to take an x-ray of that, not necessarily because I need to confirm that there's arthritis, because usually I can feel based on the physical testing that there is. But one of the things you want to do is have that as a baseline for later in life, because what could happen is, let's say that person 20 years later is experiencing more pain. And you want to see if a hip replacement might help them, and you take an x-ray and those images essentially look the same. Well, the hip hasn't actually degenerated more, right, but the pain levels are greater, which may suggest, okay, maybe surgery is not the best option versus, oh, wow, it's gotten much more severe and your pain levels have gotten more severe. So it's really someone who can manage you through the course of this that's going to be important, Isaac.
Yeah, thank you very much.
No problem. Appreciate it. Got Fred on the line. Good morning, Fred. How are you?
Good morning. I'm fine, thanks.
Good.
It's a very interesting program, and I just have to call you on this one.
Sure.
I had a hip replacement about 7 years ago, left side, and I know that I have got, when you, as I say, when you interrupt God's engineering, so to speak, you're going to feel a little bit of a difference in your body.
For sure.
One foot is a little bit larger than the other. I have muscular depletion on that side. Cannot go up a step easy as expected. But just recently, I may have twisted my body, I'm not sure, but I've got a persistent pain above that area, around sort of like in the kidney zone.
Okay.
And I'm wondering whether, before I had the operation, I went to a seminar and they told you they pretty well advised that there may be a reoccurrence or another reset on it in given time.
Mm-hmm.
I wondered if the doctor could maybe comment on the fact that based on what I described, now this is just sort of a muscular pain and it's alleviated if I take Tylenol, for example.
Okay. Yep.
But if that would be related to the hip, let's say, declining, the hip, the prosthesis declining to the point where I might have to have it reassessed and maybe even re-stabilized.
Okay, let me ask you a couple questions. The hip replacement is on the left side?
Yes, sir.
And then the pain that you're feeling in kind of that kidney area is also the left side?
Yes.
Okay, do you have any type of urinary symptoms that have changed that have coordinated with that type of pain? Because you are right, one of the things you'd want to make sure is that it's not related to the kidney. So if you've had any recent problems with urination especially, because that's the function.
Good question. I am under the care of a urologist for bladder control.
Okay. Yeah. So, that's where kind of looking at that area, you are right on one. You're right in terms of it could potentially be related to the musculoskeletal and the functional component of the hip, maybe wearing out and muscular issues responding. And then we have fascial chains, which don't just stop in one area. They tend to move around. So it could be related to that. But again, with your history, you'd also want to make sure that it's potentially not a kidney issue. I think those are two important things to consider. And obviously, my recommendation would be rule out the kidney stuff first, just because vital organs are always more important to make sure that those are healthy versus the pain level stuff. And then, once you've ruled that out, then you can start to kind of look at the musculoskeletal issue. And again, proper assessment is the key here, where you can, the functional assessment is where you'll get the answer on that for sure.
Is it customary, if I could say that, to have a surgery done on the same side?
Most replacements of any kind, whether it's a knee or a hip, they do have a certain amount of lifespan that they will last, right? Mm-hmm. That's why most physicians and surgeons will try to have the conversation with the individual and delay it as long as possible. So you never really want to, put, unless it's absolutely necessary, a new joint in someone that's very young, because every 10, 15 years, depending on the body part, those things will have to, be replaced. So, everything has a lifespan for sure.
Good. One more question, if I may.
For sure.
Could this be detected through an X-ray?
What's that?
An X-ray of the hip top, the area that was operated, taking an X-ray in that area, would that be determinant of, or that the muscular pain? I even think I may have twisted the body to the point where I got the pain that way, assuming that it's related to that or the hip, and maybe not. See, the kidney. Of course, being under a urologist and getting the blood test and the PSA every time I go to him, I would think, tell me if I'm wrong, that the detection of the case of the kidney would be detectable there or not?
In the PSA testing?
Yes.
No, not necessarily. The PSA is specific to the prostate. It's prostate-specific antigen. Yeah. So
it's the blood test that I take before I go to you. I'm not sure whether it's the PSA that they're looking at.
Oh, well, yeah, depending, urine analysis can also pick that type of stuff up. And depending on the blood work, it's potentially something that could be picked up. But I would suggest that, for sure have that conversation with your urologist, for sure. And give us a call if you want to discuss this a little bit more.
Appreciate the call, Fred. Hang on the line. We'll get to you. If you want to call 416-870-6400, star 640 on cell. A few minutes left in the first hour of this 2-hour edition of the Dr. Payne Show. Talk Radio, AM 640. Got a few minutes left here in the first hour. Then we'll get into hour 2, which is a normal hour. We extended it by 1 this week here in the Dr. Payne Show. Get right back into it. Sandy, good morning. Hi, Sandy. You there, Sandy? No. Sandy's in a windstorm. We'll talk to Glenn. Hi, Glenn.
Oh, hi there. How are you?
Good. What's going on?
I had a right knee replacement 4 months ago, and then it was badly infected. Ooh. And now we got that under control, but there's still a great deal of swelling.
Yeah.
And this is the 4th month.
Right. Have you done any rehab towards the actual knee?
I did all the rehab.
Yeah.
And then the swelling is still quite severe.
Okay. Have you followed up with the surgeon?
I have, yes.
And what has he or she suggested?
Well, he's going to re-X-ray it in 2 weeks.
Okay.
And I'm just wondering if anything can be done about the swelling that I have on the knee now.
Yeah, so I definitely think the right course of action is being taken in terms of getting to the bottom of what's going on by the surgeon, which is very important. In terms of swelling, if elevating your leg, putting ice on it, and pressure, those are some things that will help the swelling to go down. Those are very simple things that should always be followed for swelling and following surgery. But I think the more important thing is continual follow-up with the surgeon to figure out why it's still going on, because there may be something going on that you don't know, and that's the important part. But definitely from just the swelling perspective, elevation, pressure, ice are very important things and easy things that will help with that.
Is this Sandy again? Sakani. Hey, how are you?
I'm doing good. How are you guys?
Okay, what's your concern?
So a couple of years now, I've been having lower back pain, and about 2 years ago, I got diagnosed with sciatica on my right side. Went to physio, did all the work, it started to clear up. Then I started having sciatica again on my left side. The doctor recommended that I did an MRI. When I did the MRI showed that I had a mild stenosis in my lower back.
Okay.
He said all I needed to do was starting to work on it. Joined the gym, I did physio, I did rehab, I did chiropractor, I did acupuncture, I did everything.
Mm-hmm.
Pain is not going away. Recently, I got an x-ray done on my back, and it showed that I had a narrowing in my L5 and my L1. Now, the type of pain that I'm having is I can't sit for long. I have pains in my hip. When I bend forward, my hip hurts. And now the pain is traveling through my legs and giving me this numb feeling in both legs.
Okay.
So I don't know what to do anymore.
Yeah, so this is, again, the important thing here is right diagnosis equals right treatment. And so I a lot of times people come in and they say, I've done the chiro, I've done the physio, I've done this, I've done that. Yep. That doesn't necessarily mean you've done it right. And that's not necessarily your fault, Sakani. That's probably the fault of the practitioner, obviously, or maybe a combination of both. I don't know if you're not a compliant patient, et cetera, et cetera. But something like a stenosis needs to be dealt with in a very specific way. As things degenerate, it can lead to more stenosis. The other thing is the stenosis may not be a peripheral or lateral stenosis. It could be a central stenosis actually affecting the spinal cord. And the only reason why I say that is because you're complaining of symptoms in both legs. And that's very consistent. And again, this is stenosis. Anytime there's a narrowing, the important thing is to really look at the whole individual and understand the specific case. So I'm sometimes hesitant to give broad recommendations for stenosis, because then everybody listening will try the same thing. And that same thing may help some people with stenosis, but it may actually make other people with stenosis worse. So you're the type of example where I would definitely need to assess it, review the imaging studies, and then make the very specific recommendations for you that will help you specifically. Okay. Give us a call.
All right, no problem. Thank you, doctors.
No problem.
Thank you, doctors. I skipped med school. Brilliant.
Dr. Scholes.
Outstanding.
I like it. Well, come on. By now, you must know a lot of stuff.
I got my PhD, my pool hall diploma. That's how I grew up, buddy. We're going to take a short break for John, Gino, Tony. Guys, hang on the line. We invite you to hang on through the news and the break. We'll get to you on the other side of the break, as we're loving this 2-hour edition of the Dr. Payne Show, and more coming up. Hang on the line for the rest of you. 416-870-6400, star 640 on cell. We'll continue with the Dr. Payne Show in a few minutes. Talk Radio, AM 640. Okay, 12:02. That was the shortest news break of all time. That was fantastic. The coffee's not even brewed yet. I love this. 416-870. I know, right? Well, you wanted 2 hours, pal. This is how it works.
That's it. Yeah.
We started 11 today, and we're still going to go till 1 o'clock on the Dr. Payne Show. We got Tony on the line. Hey, Tony.
Hey, how you doing?
Good. What's going on with you?
A little background. I've got 3 brothers and a sister, and they've all, and in their 50s, they all had stents put in. We got cholesterol in our family.
What was the first part before the cholesterol?
It's stent?
They've all had, stents put in?
Oh, stents. Okay, yeah, I didn't hear that. Sorry.
Okay, sorry. And I'm in my 60s, and I've been lucky to have nothing. Up until about January 8th. Severe pain. I thought it was back pain, so I was tolerating it. Never went away. Had to go to the hospital. It ended up being what they called a massive blood clot in my lung.
Mm-hmm.
I'm wondering, does something like that takes a period of time to build up?
Yeah, potentially the, clots and things like that. And, anything related to kind of the vascular system doesn't just tend to happen. So, yeah, it does tend to build up. Where did the clot come from? Do they know, or it just formed in the lungs?
Well, they figured it came from my leg. But
yeah.
I hadn't been on any long flights or anything like that, but I'm a courier, and I've driven a lot over the years.
Yeah, so oftentimes deep vein thromboses are clots in the calves, and they can dislodge, and then they get stuck in the lung, and then they can lead to congestive heart failure. So, yeah, definitely peripheral vascular issues, especially if there's a history of it. Anytime you're starting to have one of the big things that we always do is if someone comes in, they have a history of any type of heart disease, and they're having calf pain or anything like that, there's some simple physical tests that you can do to start getting a sense, could this or could this not be a DVT? But then also doing some type of a Doppler ultrasound is the gold standard in terms of actually seeing it. And even sometimes that will miss it. But definitely if there's vascular issues, and a lot of times people don't even know if they have vascular issues. I would say, some of the big things here are, do you have heart disease in your family, whether that's diabetes, someone that had stroke, heart attacks, high cholesterol, et cetera, anything that constitutes heart disease. And then for yourself, some people, you can look at their skin changes when there's poor blood flow in the legs. You tend to lose some hair. The skin starts to crack. Your nails start to change. Your feet don't look very healthy. You're often cold. Those are all things that probably suggest that there's not the greatest blood supply in those areas. So, you may want to try to figure out if you potentially have vascular issues. The other reason why vascular issues are important is because in the carotid and vertebral arteries, which are the arteries that bring blood to your brain, if clots dislodge there, it leads to stroke. And that's an emergency, right? So is a blood clot for sure in the lungs, because it can lead to congestive heart failure. But that tends to take a little bit longer versus a stroke. It's a matter of minutes, right? And depending on which part of the brain, you could kill you. Yeah. Right. So definitely continue to follow up with your cardiologist and any type of vascular surgeon, et cetera, to get a good answer to that, because it is important to track for sure.
416-870-6400 *640 on cell. John, good afternoon. How are you?
Good afternoon. I have, I guess, medium to severe pain in both my ankles, specifically on my left side. That one probably hurts more than the right side. However, when the right side hurts, it also shoots pain up my right leg. Now, some history. I had a massive blood clot in my right leg last year, about this time actually, and pneumonia. So, but nobody's been able to tell me what this is all about. My GP seems to be flustered and can't figure out why I'm getting this pain.
Okay. How's your health overall? Like
generally, it's good.
Okay.
I'm on blood thinners now as a result of the clot.
Okay.
But it's such a pain, especially when I get out of the car. It's very, very painful.
So go ahead. Sorry.
Yeah, and then it'll subside a bit, but it's always there. There's always a level of pain in both legs.
Right. Okay. When I asked about the health, even are you overweight at all?
Yeah, I am, and I'm working on bringing that down.
Now, how bad? Is it something where it's just a little overweight, or are you in the obese side?
I'm 6 foot, and I'm probably weighing in about 240.
Okay,
I
so
probably stand to lose about 40 pounds.
yeah, for sure. So that's a big thing for sure. With issues like that is really getting into a healthy lifestyle, bringing that weight down, and it tends to help a lot with those types of things. And again, sometimes it's also just genetics, right? Sometimes you can be perfect body weight and have all the right things, and you just, your genetics for whatever reason sometimes end up screwing you, and you might just be predisposed to those things. It's the reality. Diabetes is in my family. I'm sure I'll be screwed one day no matter what I do. But yeah, definitely doing your best to try to get in good health and managing your weight for those types of issues is going to be very, very important.
Okay, thank you.
No problem.
Thanks, John. Appreciate that. Tony, thanks for hanging in, pal. What's going on with you?
Yeah, sorry. This is just a little follow-up to my lung problem.
Yeah.
A couple years ago, or maybe 3 or 4, and I've been lucky with the heart thing. It's in my family all over the place, but I've been lucky. A few years ago, I was having beer and some wings at home, and I felt nauseous. And so I didn't want to have anything else, so I went to the kitchen, put them down, and I collapsed in the kitchen, gasped for air, and I just went out. And a few seconds later, my son came pick me up, and I was sitting down, and it seemed to pass, and it seemed like within a few minutes everything was fine. Could that be related to that clot that was building up yours a long time ago? Or?
Well, it could be related to, again, the fact that it may not necessarily be that specific clot, but maybe the fact that there's a bigger overall heart disease, peripheral vascular issue going on, where that may also have been affecting your heart. Other things, it's very hard to say. It could have been related to that. I'm not sure, but it does definitely sound like there's a component of heart disease here. And, again, that's a very, very important thing to control, getting the right medical treatment as well as doing the right lifestyle things, right? Eating the right foods, exercising, just some 30 minutes of walking 3 or 4 times a day can really drastically improve those things, especially when you look at cholesterol levels. People who are on cholesterol medications, their LDL is what usually is high and their HDL is low, which the HDL is the happy cholesterol. Yeah, the happy cholesterol. And so, one of the biggest things that increases HDL, which tends to decrease LDL, is movement and exercise. That's what produces HDL in the body. So definitely, I think, healthy lifestyle is a very, very important thing. And again, continuing to get the medical care that you're getting.
Yeah. I guess when that happened a few years ago, since then I lost probably about 40 pounds.
Okay.
And I'm on cholesterol and all that kind of stuff. It was just that one episode I had, never had it repeat, but then I only had this lung problem. I just wondered if that'd be connected somehow.
Yeah, it could be. There's a lot of things it could be, right? It could be some viruses are pretty nasty and can mimic a lot of things if you've been sick, et cetera, et cetera. If you were dehydrated, poor, whatever. There's a multitude of things it could have been. But for sure, that it could have also therefore been something to do with the vascular system for sure as well.
Tony, appreciate your call. We'll take a quick break here. The second hour of the Dr. Payne Show continues. 416-870-6400, star 640 on cell. Lots more of your calls coming right up on Talk Radio AM 640. 12:12 here, the normal hour. We went 2 hours today, right till 1 o'clock. Loving it. You want to call after the show to book a free consultation, 1-855-55-Dr. Go to info@paincarecanada.com. We had a friend of yours was going to call in, but she's a little shy.
Yeah, she's shy. She doesn't want to call in. But it is a very interesting case to share with everyone, and she thinks it might actually help other people. So a quick little thing about her health history is she was diagnosed with psoriatic arthritis, which is one of those autoimmune type of arthritis. And she was also, one of the things with those is you're on a lot of different medications, autoimmune medications to stop the immune system, and also corticosteroids. The problem where that complicates people's lives, she's my age, is her and her husband wanted to start having kids. And you don't necessarily want to be on that heavy dosage of medication while you're doing that. So she's messaging me saying, how do you manage that without taking the pain medication? And it's a great question. And, people that are listening going through the same thing, it is hard, right? Especially when you're dealing with autoimmune things. The biggest thing when you're dealing with any type of very serious pain thing like an autoimmune condition or chronic pain is there's a lot of people where a lot of times people forget to consider the other things that contribute to pain. And it's not necessarily always just the chemical issues, but there's the physical issues. So doing, again, continual treatment, acupuncture, physiotherapy, different types of things that you can still do through pregnancy. There's also good nutrition. Good nutrition really helps to play a role in pain levels, depending some things are pro-inflammatory and you'd want to eliminate those things. And the other big thing is the psychological aspect, right? A lot of times these issues tend to they go hand in hand, right, where the person's psychology is affected. So also managing your mental health. And so in the absence, and, the best approach is really trying to take it from every angle there. But if you can't do one because of a certain circumstance in life, like you're pregnant and you don't want to be on that heavy dosage of medication, that's just one silo of that bigger amount of things that you can do. And you could still be targeted from all those other issues. And at the very least, it may not necessarily be as good as if you targeted it from everything, including the meds. But at the very least, it's better than not doing anything. So I hope that kind of helps people. If anyone has more specific questions on that, again, it's more related to the specific case. But I definitely wanted to touch on that. I was hoping she would call because I thought the call would be nice to have someone that's a good friend and a patient of mine, but she's a little shy.
That's okay. Anna. Hi, Anna. How are you?
Hi, Dr. Lou.
Hi.
I am seeing a lot of advertisements for spinal decompression, laser type procedures to relieve spinal pain, spinal stenosis. My father is 86 years old, so he's up there, and he's got congestive heart failure, COPD, but all of his conditions are really well managed, and he's stable.
Right.
One of the worst things about what he's enduring now is the pain in his spine.
Right.
He uses a walker. He's able to get around, but his walking is becoming more painful and more labored. And in order to keep, the congestive heart failure, not at bay, but to manage it, moving is important.
Yep,
now,
absolutely.
What are your thoughts on spinal decompression, laser procedures that you hear advertised on TV and on the radio? Is it safe for somebody his age, or is it just out of the question?
Well, what I'll say is that I think every treatment intervention that we have available to us in society definitely plays a role, 100%. It's just who does it play the role for is the bigger question. And that's the harder thing for us to pair up in healthcare is who responds to what. And, sometimes even we tend to think, yes, this will help that person. And then it doesn't, just because everyone's different. And you may have the best available research saying, yes, this is the gold standard for this issue. That person doesn't do that or does do that and it doesn't work. And that's just the reality of healthcare. What I can tell you for spinal stenosis that's important is you are absolutely right with his other comorbidities going on is that continual movement is absolutely essential for him. Now, understanding the pathology of stenosis, one of the things is, and I'm sure you've noticed with your dad, he's kind of stooped forward when he's walking.
Yes.
That's his
big time.
Yeah,
big time.
His body is naturally doing that to take pressure off the nerves in the spinal cord where the stenosis is happening because it's opening up that area. So one of the great things to keep cardiovascular health and also help to manage the spinal stenosis is riding a bike. Yeah, and so you can get special ones. I don't mean like, a spinning bike that someone who's in great shape would use, but there are bikes that have the bigger seats where you can kind of sit down.
Recumbent bikes.
Yeah, recumbent bikes. Yeah. There's also sometimes you can go to different healthcare stores, and again, you can give me a call. I can help facilitate this, where it's just pedals that you can get that you put in front of the chair. And so they're already kind of in that seated position. And again, that's going to benefit their cardiovascular health and not necessarily hurt their spinal stenosis. So, and again, I guess my overall answer to what your question was is yes, everything plays a role in treating people. The bigger question is pairing up for which people it's right. And I'm not necessarily sure that, laser or decompression therapy would be the right thing for your dad. Number one, because I haven't actually assessed them. So after I do, maybe I would think that. But yeah, that's the hard part in healthcare is pairing up what the right treatment is for the diagnosis.
But the fact that he's 86 with congestive heart failure, with COPD, both of which are being managed, just on the surface, and of course I don't take your word without you investigating and seeing him, but just clinically and based on what I'm saying, is he absolutely it's not an option based on what you're hearing from me? For spinal decompression, laser surgery for the spine. I keep seeing these seniors saying, oh, this saved my life.
Well, of course, everything's an advertising. Big companies don't tend to advertise and say, yeah, this doesn't really work.
It's awful.
But what I meant is that it shows older people as candidates.
Right. Sure.
And I get it's an advertising.
Yeah. Again, I want to be a little hesitant to specifically answer that just because I'm not 100% sure. I can definitely tell you on the laser surgery, I that may be an option. But with decompression therapy, It really, really depends. Sometimes it can actually make people worse.
How fragile the area is.
Yeah.
Right?
So again, I'm a little hesitant to answer it specifically, just because I don't want anybody listening, whether it's you or someone else, saying, yeah, that's the option. You need to pair it up with the person, and I'm not going to, it doesn't do it justice for me to just give broad stroke advice like that. What I am happy to say is that it may play an option, and we just need to figure out if it is an option to consider.
Hey, Sharon, we'll get you in quickly before the break. We got a lot of calls lined up. What's going on with you?
Okay, Dr. Lowe, I just want to find out, I got a few nodules in my throat, and half of my thyroid is out, but the nodule is floating, and whenever they put needle in my throat, they cannot get a biopsy, and therefore I just wanted to know what you have to say about it, and what food I should prevent, and if I should keep taking this needle, which is a terrible thing to put through my throat, and then they cannot get a biopsy.
So what is the thyroid problem? What is it?
No, I have floating nodule.
Oh, floating nodule. Okay, yes. I saw on the screen here it's a thyroid. And so they want to try to biopsy that nodule?
Yes, and what happened, they put needle in my throat, and twice, 3 times, 4 times, and then the specialist tells me to go back because they cannot, it's floating and they cannot get it. So the last time I did not bother to go back, so he said to come back in March, and they'll do ultrasound again, and then we'll go over it again.
Yep.
And then also I heard that I shouldn't eat broccoli because that is not good for it. And so I just wanted you to throw some light and tell me what I should eat and what is this floating nodule about.
Yeah, so what I can tell you for sure is I don't think you should really be worrying on the diet side of things. I don't think that's as important maybe as you've been led to believe. What I can tell you is that you need to get it checked out to see what it is. Sometimes with procedures, they can also do ultrasound guided procedures where they're actually doing the ultrasound while they're trying to get there. So that may be the next option when you're considering with that doctor, that may be an option they're considering, just so they can actually see where they're going, versus a standard biopsy where you're just kind of trying to guess and not guess, but a clinical guess. But sometimes, I think the important part here is getting figured out what that is. I've never heard that broccoli's bad for that, so I can't comment on that. I would say most vegetables are healthy, but I'm not
caught there or something.
I'm not 100% sure, but I would say the biggest recommendation is continued follow-up to figure out what it is.
416-870-6400 *640 on sale. Lots more of your calls coming right up after a wee little break here on the Dr. Payne Show, Talk Radio, AM 640. Yeah, and a reminder as well, 1-855-55-Dr. Lou. You can leave a message like you would be calling on the air here and get an answer and a consultation with Dr. Lou after the show. Is
option,
we got
option 2 when
option
you call.
2, is that what it is?
It's going to leave me a message. It gives you a little rundown of what to do. It leaves me a message. I'll get back to you within 48 hours just because our phone lines are jammed right now, but that's great. Keep the calls coming. But for anyone who can't get us before the end of the show, I'm happy to help you anytime. And again, I'll get back to you at the latest within 48 hours, but usually within a few hours of that message. You may also want to leave when is a good time for me to call you back. The other thing is the social media stuff. So Twitter, Facebook, Dr. Lou on Facebook. You can send me Facebook messages. Again, it's more similar to this where there's a big following and we can kind of discuss issues with everybody and help each other.
Got John on the line. Hey, John, how are you, pal?
Oh, not so bad. Well, not so good.
All right. That's why you're calling.
You're not calling if you're good.
Yeah.
I would say for the past 3 weeks, I've been, I got my right scrotum has been really, really swollen.
Ooh.
It's like severe pain, and it's basically swollen to the size of a large orange.
Okay.
And, I went to the hospital, and they, checked it out, ultrasound, and what they came up with was something called epidermolysis.
Yep.
Trying to find out what that is, and they're like, what I'm concerned about, like they give me antibiotics, and that's helped the bacteria and the pain a little bit, but it's still swollen and very, very hard.
Yeah. So
would that be damaging the testicle, or?
Would it be damaging? I mean, nothing is ever good. Is it damaging it? The important thing is you've done the right things. Anytime you see that, how old are you, John?
I'm 50.
50. Okay. So the big thing with swollen testicles is you start worrying about, testicular cancer. However, you're out of the age range. It is the most common between like 18 to 30. So obviously you did the right thing by going to get it looked at, and they found that it's some type of an infection. In all honesty, it just sometimes takes time. It could take longer than what was initially expected. Antibiotics are definitely a component to be playing in that. And you need to continue doing that. I would also suggest that you follow up with whomever you saw and just let them know it's still there. But yeah, sometimes these things can just take longer than what was expected. But the important thing is to make sure that it's not something more serious.
I mean, they're going further. They want to do more ultrasounds. Like, I'm finished my antibiotics. They give me about 14 days worth.
Yeah.
And they said that, okay, we're going to test everything, do a PSA test.
Yep.
And also check the sperm, I guess. They want to make sure nothing's in there. I don't know what else they're going to look for. And they said that the swelling will be absorbed by the body. Is that accurate, or did I just, pee it out? I don't know.
No, usually it is going to be absorbed through the lymphatic system. But yeah, those are all the right things that are being done, and I just encourage you continue down that path and get the answers. Like that's all that you can really do is keep trying to get answers. Anytime in the absence of a resolution, you need to keep looking, well, what is it? What could it be? And one thing that I've encouraged people to do, because I do find this is a problem, is a lot of physicians do tend to become dismiss it, or healthcare practitioners where it's just like, it's nothing, blah, blah, blah. No. You're responsible for your healthcare. People need to understand, as a patient, you're the one in charge. We're working for you, right? So you're in charge. Make sure that the people you're dealing with are trying to get to the bottom of the issues that you're facing.
Got Tracy on the line. Good afternoon, Tracy.
Good afternoon.
Hi, what's your concern?
So I've been having an issue. My left shoulder, I have a lot of pain in my left shoulder. And I saw my GP, and I work out a lot. He told me it was pain from working out. Doesn't feel like that to me. I do get sore muscles a lot from working out, but so I stopped working out that specific muscle group, and it hasn't actually gotten better at all.
Okay.
And it's not constant, so it comes and goes, and it comes on at weird times. Like yesterday, I lifted a box that was maybe a pound, and shooting pain just went up and down my shoulder like I had popped it out of place.
Okay. Yep. So, again, sometimes it could be related to a caller earlier in the show. It could be related to impingement issues where, again, the posture of the shoulder is affecting the structures in that area and putting more pressure on one area than another. Another thing that's shooting and shoulder always makes me think you need to get your neck checked as well to make sure it's not a nerve issue from the neck referring pain, which is often missed in shoulder issues because you tend to feel the pain there. And so the practitioner and the patient believe the source of the issue is therefore local, but sometimes it could be some type of a radiating pain from the neck. So I would say those are two important things to consider with the shoulder issue, is that, you may have stopped, but if it's a postural issue, then your posture probably has an overall change, and there's still probably extra pressure on that. And then the other thing to consider is, could it be a neck issue radiating pain into that area?
Okay, someone who I actually go to the gym with mentioned that because I'm on a low-calorie diet and I do lots of strength training exercises, that I may have damaged my muscle, but I don't eat enough calories to be able to repair it. I don't know if that's
for sure. That's all, that's our body's fuel, right? So, and that's all, it's going to take the fuel to fix the things that we have problems with. So if you're on a low calorie diet, that could also be an issue where your body just doesn't have the right energy. The other thing that happens when you're in a low-calorie diet is your body goes into what's called gluconeogenesis, which just means making of new glucose, and it will start to break down muscle in order to do that, right? So if you have a muscular injury and then at the same time you're in a state where your body is breaking down muscle, it's probably not a good combination. I think that's something you may want to consider and get that looked at as well.
Tracy, I appreciate the call. We'll take a short break. More of your phone calls coming right up after a little one here, 416-870-6400, star 640 on cell. And if you don't get a chance to call us today or You're not by a phone, 1-855-55 Lou. Option 2, leave a message, and Dr. Lou will get back to you after the show is over. More of the Dr. Payne Show coming right up. Talk Radio, AM 640. It is 12:33. You are busier than a one-legged man in a butt-kicking contest, my friend. There are a lot of phone calls coming through.
Your one-liners are the best. Some of the things you've said to me I've never heard before.
And you'll never hear them on the air as well.
Yeah, exactly. If only people know what happens on the break here.
That's right. Hey, Shelley, good afternoon. How are you? Shelley. Hi.
Hi, how are you?
Good. What's going on with you?
Well, I have a number of things. I have 2 bulging discs in my 4 and 5. I have a torn disc, or tear in the disc, whatever you want to call it. And I have arthritis in my back, as well as the other, it starts with an F. And at any rate, I have a good doctor. He's been managing the pain, of course, with medication. I've tried many different things, between laser, all kinds of things. Right now, I've been currently going through the process of having nerves, for lack of the right term, burnt, where they use the x-ray machine, they insert the needle, and they put a burning fluid in, or I'm not sure exactly what it is. It sometimes causes me even more pain and lasts for extended periods of time when they're burning the nerve. And the medications, of course, you get somewhat immune to them, so you have to back off, go on to different things. I find it makes me so tired and so exhausted, the whole process, mentally, physically, and I'm still in this pain where it's just bearable, just manageable even with the medication, and you can't go on more. I don't know what else to do. It does affect me mentally beyond imagination, and I'm torn as to what else I can do. Where can I go? I mean, they're doing what I think is the best they can do, but I'm not I went to a surgeon, and I'm not a candidate for surgery. They said it could cause more damage than I already have, possibly. So honestly, I'm just kind of exhausted, and I've been on medication now for well over a year, and I was on fentanyl, which I hated. It just made me want to sleep.
Yep.
So now I'm on a hydromorph, a low dose of hydromorph with a maximum of 4 Percocet a day, which it's just...
Okay, so Shelley, let me stop you for a second. Besides the medical interventions that you've done, have you done any good rehabilitation?
Well, I did go to. I can't afford. I'm right now not currently, like, if I excel, I can't work, because if I excel for more than one day, then I'm off for 2. It's so, and I don't have the finances to continually go to a therapeutic process where they're constantly doing massages or whatever. So the only thing that I've been able to do is through the medical process that's covered.
Yeah, there are some options, some OHIP options for physiotherapy, however, if you qualify for them. The other thing about when I say physical treatment is you don't necessarily have to do a million physical treatments. When you're working with that type of a professional, be it a chiropractor, a physiotherapist, athletic therapist, whomever, a lot of it is the advice that they're going to give you and the exercises that you need to be doing, which is a very important component. The other thing that's extremely important in your type of case is control of the mental aspect of pain. Cognitive behavior therapy tailored towards pain management. Because again, we've gone through this a lot on the show, where your body learns pain, and that pain may not necessarily be due to a physical problem anymore. It may just be due to the fact that pain is now created in the mind, and so you have to target the mind. So, and I see a lot of cases like yours, and I actually saw a lady this week, and it was a very sad case, because I saw that all she was put on was just a bunch of different medications, which again play their role, absolutely. I don't doubt that, and I encourage that as well. But again, as I mentioned when I was talking about my friend with the autoimmune issue, when you look at pain management, you're looking at it from the chemical interventions, you're looking at it from the physical interventions, from from the mental interventions, and playing a role between all of those things, even support systems. A lot of the time we say psychosocial, where we're considering the person's disposition and mind, as well as looking at what's their environment like, having a healthy environment. Like, a lot of people are not happy in their lives, and that tends to affect everything. So proper pain management needs to be all those silos of care working together. And unfortunately, in your case, Shelley, it sounds like you're just doing one of those, and you're missing another 3 or 4 potentially very important ones to try to get your body better. And I know it's hard work. I know it can cost money. It unfortunately is just the reality of the way this works. And I understand where you're coming from, but the reality is that sometimes, you got to do it. And if you want to get better, it may cost a little bit of money depending on where you're going. Again, I think there's better places than others that aren't necessarily looking to rip people off. I have providers around. Give us a call. I've personally myself, if someone doesn't make enough money, I've treated people for free. For me, it's not about the money. It's about getting people better. So give us a call. Let me go through a proper assessment with you at the very least to try to make very specific recommendations.
Shelley, that number 1-855-55 Dr. Lou. We'll get to one more before we go take a break. Hi, Joe.
Good morning, doctor.
Hey,
good morning.
Joe.
I was mentioning to the other fellow doctor, I have congestive heart failure and a pituitary tumor. And I've been treating that. I've been having treated that for a while now, for maybe about 5-7 years, and everything seems to be under control. But the problem that I have constantly, doctor, is I'm constantly in pain, tired. I tried your products, the ones that you sell in your programs, from Purity Products and from Dr. Newton.
No, that's not me.
Yeah, the latest one that I tried was a magnesium and calcium combination that I thought it might work because they were hitting the nail on every symptom that they said that
No, but you said those were products that I sell. I have nothing to do with those products.
Sorry. I meant the radio station.
Oh, okay. Yeah, no, it has nothing to do with me.
Right. It's a program. It's a program that they have here at AM 640 on Saturdays by the Purity Products and Dr. Newton. So I tried those products. And they don't seem to work. The problem is, I'm constantly in pain on my legs, tiredness. So I figure, by trying some of these things, it might work, but nothing seems to work. Do you have any ideas, doctor, as to what I could, as a supplement, maybe that could help me with my pain?
Yeah. So what I will ask you now is, what's the other aspects of your lifestyle, like diet and exercise?
My diet it's okay. I was exercising up to about 3 weeks ago, doctor. Thank you for bringing the point again. Up to 3 weeks ago, doctor, I would do exercising about 3 times a week, doing a bit of bicycle because of my heart condition. But 3 weeks ago, doctor, all of a sudden I had a change in my heart, meaning that, all of a sudden I could, if I was able to walk, for example, a mile or a couple of miles, all of a sudden I couldn't even walk, for 500 meters. So I had to go to the hospital, and they told me that everything was fine. And yet I feel shortness of breath, and I feel tired. It's not like I used to do about 3-4 weeks ago.
Right. Well, I would definitely say what's important in your scenario is a very good lifestyle for sure. And then also figuring out why that would have happened 3 weeks ago. It doesn't sound like there's a proper answer to that. And because of that, I would not, specifically recommend any type of supplement for pain. And again, what I just said to the last caller, pain management is managed by a bunch of different avenues. And I'll state it again. It's the chemical stuff. It's the nutritional stuff. It's the exercise stuff. It's the physical rehabilitation stuff. It's the surgery potentially. There's lots of silos, and pain management needs to include all of those. But it also has to be tailored specifically to your specific issue and comorbidities, right? Mm-hmm. Because you want to make sure that you're recommending things that don't, as we were talking with, I forget her name, but about her father with the stenosis. You don't want him to stop exercising because he's got heart issues, but the exercising is contributing to pain with the stenosis. Right. So what's the right exercise? And that's where, I mentioned the biking. So these are issues that you got to take it from every single angle.
More of your calls coming up here, 416-870-6400, star 640 on cell. You can go to info@paincarecanada.com. And, of course, your consultation's free. Get in, see Dr. Lou, 1-855-55 Dr. Lou, DRLOU. Dr. Pain Show, Talk Radio, AM 640. 416-870-6400 star 640 on cell. Is it Cheyenne?
Hi.
Hi.
How are you?
Great. How are you?
Good, thank you.
Okay.
I've been having headaches. They've been on and off since last year. I had an MRI. Everything came back clear. And over this past week, I don't know if it was stress-related. I don't think it was stress-related, but I've been having constant dull headaches at the back of my head, and it kind of affects my vision. And I've been a bit dizzier. I've been taking ibuprofen for a bit, but I don't want to keep popping them constantly. I'm scared of kidney damage. So I was just wondering if there was anything you could recommend.
Yep, for sure. So a big component for headaches to consider in the absence of true pathology, which would have been ruled out in the MRI, is, and you said the base of your skull is neck issues, right? And so your neck posture, depending on what you're doing, most headaches have a neck component. And so getting the neck treated can very, very much help those types of headaches for sure. And so, again, the big thing with headaches is making sure that it's nothing serious, which, again, the MRI would have looked for those types of things.
Right.
And so if it's nothing serious, in my experience, most other types of headaches, even if it's, say, something like a migraine, a cluster headache, a tension headache, a cervicogenic headache, they all have a neck component, and treating the neck, for some of them, say it's cervicogenic or tension type headaches, tends to be exactly what you need, and it helps resolve 100%. But then even with the migraines, I have a ton of patients who I treat for migraines, and I do a lot of neck work with them. And it may not necessarily resolve the issue 100%, but it definitely helps to manage it because it does play a role. So I would say for sure getting the neck checked out from someone who's proficient in that, like a chiropractor, is going to be a good choice.
Cheyenne, you spend a lot of time on your phone, your tablet, looking down?
I do, actually.
Who doesn't now, right?
See, you're a detective, John.
Doctors.
You're a doctor, buddy. You know this stuff.
That can be part of it, though, right? For real.
100%. Yeah, that's a big thing with, especially the world we live in now with phones, and we're always looking down. And it's also smaller, right? It was bad enough when it was a computer and a full keyboard, and now we're even coming in closer. One of the big patient bases that I have is actually dentists, because they're used to working in that confined space, right? And they have a lot of neck, upper back issues, and that's what the public is facing now with tablets and phones.
416-870-6400 star 640 on your cell. Is it Poran?
Poran.
Poran, how are you?
Very good. Thanks for taking my call, doctor.
No problem.
This is in regards to a diagnosis I had for trigeminal neuralgia.
Yep.
3 years ago, I had a tooth graft done, and after about a couple of months, I started to get a shooting pain.
Yep.
So I went back to my dentist. He recommended I do a root canal on my number 24 tooth on the top. So I did. He said that will solve the problem. Well, it did not.
Okay.
So in 2005, it was so bad, I ended up in an endodontist. He diagnosed it's trigeminal neuralgia.
Yep.
I was given then the gabapentin. I was taking a minimum dose. That is, I'm still taking it. I tried to reduce the dose gradually after the pain subsided, and I felt I was going to test it. The pain came back. I had to go back on the dosage originally recommended. And I am taking that until now, except recently I am getting a slight shooting pain. And I know it started once before like that, and it got worse. So I am wondering, what do I do? What's my next step?
Yep. So for our listeners that don't know what trigeminal neuralgia is, what that is, the trigeminal nerve is one of the nerves from the brainstem that comes into the face, and neuralgia, the word simply means pain of the nerve. That's which is nerve, and algia, which is
fibromyalgia.
Which is a term for pain. So pain of the nerve, and specifically the trigeminal nerve. So that's kind of, again, I talk a lot about what's a true diagnosis and what's just mentioning a sign. So people will say, I have sciatic nerve irritation, which, good, that's not a diagnosis. That's a clinical sign. Same as trigeminal neuralgia. I think the bigger component for you is getting someone who can actually figure out where the trigeminal neuralgia is coming from. And it sounds like you've just been dealing with the dental profession. It may not be a bad idea to visit with your family doctor and maybe have a referral to an ENT.
I did
okay.
get this gabapentin from my family doctor.
Okay. Has your family doctor ever referred you to an ENT?
ENT?
Yeah.
Ear, nose, and throat?
Yeah.
I would say no.
No? Yeah. So that may be the next option, right? Getting someone who specifically specializes in those areas and trying to figure out exactly what exactly is causing that trigeminal neuralgia.
Okay. Who is ENT? That's an abbreviation.
Yeah, ears, nose, throat specialist.
Oh, I see.
Mm-hmm.
Okay.
Yep.
Okay.
Yep.
Great. Okay. Thank you then, doctor.
No problem.
Oh, there she goes.
Oh,
appreciate the
she
call.
hung up.
Yeah. 416-870-6400 star 640 on cell. Got a few minutes here. Take your last few phone calls in the second hour of the Dr. Payne Show. See you there, Joan. Hang on. We'll get to you right here. Talk Radio AM 640. 12:53. Last few minutes here. It was good. 2 hours. We got to do this more often, I believe. Joan, how are you?
Not too bad. How
right.
are you today, gentlemen?
Good. What's your concern?
Well, I've been diagnosed with several health issues.
Mm-hmm.
But one that's really terrifying is I've been diagnosed with unfolding thorax.
A folding thorax, okay.
And there's times when I can't breathe out or breathe in. It's really terrifying.
Okay.
I don't know what to do. I've had a CAT scan. I've been to see an oncologist. Now I'm having another CAT scan a year later, and in March I'm seeing the same oncologist after the CAT scan has been done. But it's very scary.
Okay. Why have they sent you to see an oncologist?
I don't know. That's a good question.
Okay.
There's also on my lung, the right lung, there's they call it similar to cut glass.
Okay.
Or not cut glass. What do they call that? Ground glass.
Okay.
And they're checking, I guess, on that. Maybe that showed up in the previous CAT scan. I don't know.
Okay.
So I don't know what to do. It happens at any time,
mm-hmm.
even if I'm just reading or
mm-hmm.
something, and I go to take a breath or breathe out, and I can't breathe at all.
Right.
The last one lasted for about 40 seconds.
Okay. Yeah. So I would definitely say for sure you have to keep, again, seeing the healthcare professional that you're dealing with and do the recommended referrals to try to get to the bottom of this, deal with people who specialize in this type of issue. The other thing that, you may want to consider is an important part of breathing in the thorax is the muscles and joints in that area. Mm-hmm. So maybe getting someone, and again, this isn't a cure to your problem, but just to kind of help the issue as well, is see someone who can work with those things and try to, make sure that the muscles, the joints in that area are healthy, just so that way you can have a little bit more breathing that's a little bit easier. But I would definitely say you have to continue following up with the specialists that have been recommended to try to get to the bottom of exactly what's going on.
Well, this is and my voice has changed. It's getting deeper and deeper.
Yeah, so for sure, this needs to be attended to. And I think the important thing, again, is the proper diagnosis. So that should be your main concern, is getting an answer to exactly what's going on, why it's going on, and what your best treatment options are.
Well, that's the thing. The last time I saw the specialist, I wasn't even in there for 2 minutes, and I was out.
Right. Yeah.
He really didn't explain it. He just said it's like he didn't say anything about the throat. It was about the lung.
Right. Yeah. And so again, and this is where your family doctor is the gatekeeper, right? So if you have issues and you want a second opinion, just have that conversation with your family doctor, right, and get a second opinion from another specialist. Then,
yes, our family doctor is very good.
Yeah. So, and if you have a good family doctor, continue working with that person, get them to send you to more people, get the answers you need.
Judy, you got about a minute here. What's your concern?
I'm turning my radio off, sweetie.
All right, good.
I'm calling because a friend of mine had a routine colonoscopy.
Mm-hmm.
Yep.
And during the procedure, her intestine burst.
Okay.
And they supposedly fixed her up and put her back together.
Mm-hmm.
But now what's happening is she's got to go back in because it's herniated.
Mm-hmm.
And she says she has like she calls it, she's having an alien baby because it actually does look so big and it's really bothering her.
Okay. And what's the question for us specifically?
The question is, she went back to the doctor that did the surgery and he said, yes, it's a hernia and wait 6 months and we're going to have to go back in and fix it.
Yep. Okay.
Now, my concern is she didn't have any polyps or anything, and I'm thinking I would like her to go to another doctor and have it done. I'm worried.
Okay. I mean, I think being a good friend is an important thing. I do think at the end of the day, people's healthcare choices are up to themselves. So if you have that conversation with her and she seems to agree with you, she goes to her family doctor, gets a second opinion. Based on what I'm hearing, it sounds like the right things are being recommended. But yeah, that's really as much as I could say to that case is that if you want to be a good friend and you think people should get second opinions, you should all, to be a good friend, a good family member, you can state your opinion, but don't try to push it on people. If she thinks the right things are being done, you also don't want to create a psychological component and a scare factor. Let her get the things that she needs to get done.
Was a busy 2 hours this week indeed. We're back to our 12 to 1 o'clock slot next week here on the Dr. Payne Show. In the meantime, you didn't get to call in. You have more questions. 1-855-55-Dr. Lou. That is the number you want to call. info@paincarecanada.com. Get on it. Get your treatment happening, free consultation, and talk to Dr. Lou as soon as you can. Until next week, the Dr. Payne Show, Talk Radio, AM 640.